Okay, hello everyone, Dr. Rich Castellano here, the Smile Doctor. We are here to do an image lift procedure for Ellen today. Ellen, thank you for letting us share your procedure. And Ellen saw us on Facebook, on social media, and she saw our videos and learned more, and now she's here today. So here is her picture when you see her upright, and she's taking good care of herself, but just wanted to tighten some things up. Ellen, can we ask what it was that inspired you to do a cosmetic treatment?
Well, I think because I'm at that age now where things are looking a little older each and every almost day, it seems like,
Okay.
week. And because of my business, I would like to look as nice as possible when I'm dealing with the public.
Got it. Okay, thank you for sharing that. Is it okay if we share how young you are?
Sure,
How young are you, dear?
I'm a young 66.
There you go. And this is not the face of a 66-year-old. People are living so much longer, taking good care of themselves. We're just going to zoom in here. I'm going to do some of the tumescent solution. And how long were you thinking about it before you said, I'm going to do this?
To be honest with you, not very long. Once I saw it on Facebook, and I'm trying to remember when that was. Seems like it was just a few months ago.
Yep.
I pretty much quickly looked right into it.
Okay, very good. And you had a chance to go through our book?
I did.
Was that helpful
I
to
did.
look at our book? We guarantee we can make you look younger. It's on Amazon. Was that
Yes.
helpful?
Yes, it was very helpful, and your attitude was the most helpful.
Okay, good, right. Because patients come here because they don't want to look extreme or severe. They don't want to be overdone. And so that's what we accommodate. We've all seen it when things go too far, and that's why patients come here, so that they can protect themselves from the unnatural appearance. And so you're an excellent candidate. We're going to be doing the upper eyelids and the lift. So did you tell any of your family? You mentioned you told some of your family or friends
Well,
what you were...
I told one good friend because I thought my husband might be working and not be able to bring me, and I was hoping that she could bring me, and she was going to do it, but then she remembered at the last minute that she had a dentist appointment, so it didn't work out for her to bring me, but
So your husband's going to drive you.
my husband is gonna
Perfect.
drive me.
And then what we like to do is we like to do the 1 day follow-up, 1 week, 1 month, 3 months, 6 months, 9 months. So, and we'll see you tomorrow. And I'll call you later this evening just to check in and make sure you're doing fine.
Okay.
So what I like to start out with, this is the 1% lidocaine with 1 to 100,000 epinephrine. So you'll feel a little pinch here on 3, 1, 2, 3, pinch. You feel big pinch, little pinch, not too bad?
Not too bad.
And you've had some of the relaxing medicine. Do you feel comfortable?
Well, I feel a lot better than I did.
Do you think you want a little bit more relaxing medicine? I can give you more if you'd like, because right now where I'm doing the numbing, that's pretty much the worst of it. But if you think you want to feel more relaxed, we can give you more. How do you feel about that? You want to give it a little bit of time and see, or do you want another tablet while we're talking about it?
I think I wouldn't mind having another tablet.
Yeah, we'll give you another one. And as long as you feel comfortable. The medicine sneaks up on you. I had a patient tell me, she said, well, I don't feel that relaxing medicine, not one bit. And then she goes, she started snoring. So, all right, we want to give her one more relaxing tablet. So for the physicians and students that are watching, we monitor, this is the tumescent solution, lactated ringers with lidocaine 1% and a little bit of bicarbonate. You'll feel a little pressure. Do you feel a pressure pinch there? Not too bad?
Not bad.
Tell me what you feel right there.
Hardly anything.
So a little bit of the numbing medicine, and once I do the numbing all under the jaw, chin, and neckline, then you really can't tell what I'm doing. And Ari's getting your relaxing medicine for you. Blood pressure looks great, pulse ox looks great, and heart rate looks great. Most importantly, Ellen looks great. If Ellen's talking to us, I see her breathing and resting comfortably, then I know that things are on track. You feel a little pinch there?
Not much.
So we're going to do the laser lipolysis, plus we're going to be doing the lifting procedure under local anesthesia. Thank you for watching. Thank you for sharing. Hello and welcome. Okay, yeah. So here's a little tablet, open real wide, and if you chew it, it takes effect a little more quickly. And then Ari's going to get you a little something to drink here.
When you're
Open
ready.
real, just let your head rest all the way back. And if you
I'm
open
just gonna-
wide, we'll drizzle in for you. Just drizzle a little. Open, 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 open. There you go,
There we
open. You want one more sip? Here you go. Open real wide, open, open, open. And a little drizzle.
Perfect.
Okay, did I get it in for you? You want one more sip or did I get it?
Maybe one more
One more
sip.
sip, okay, not a problem.
There you go.
Ari's our expert pourer. She has a lot of training just to make sure she hits the bullseye.
Perfect.
Okay, very good. Little pressure, a little pinching. So a little bit of the numbing. And patients feel very comfortable with this approach. It's definitely better than having general anesthesia. You know, general anesthesia just takes, even if it's IV sedation, it can take things, it takes your system out of whack a little bit, and people will deal with the constipation afterwards and all these things. So, you know, it's always better to have the minimalist approach, to do the least amount of anesthesia that you need to get the job done, and that as long as you feel comfortable. Thank you for watching. Thank you for sharing. If you're following us on Facebook, make sure you put the alerts on imagelift.com, or it's facebook.com/imagelift. We're also on YouTube right now, youtube.com/imagelift, and we're on Instagram, imagelift now on Instagram. So thank you for watching. Thank you for sharing. It's an honor that patients get to see our marketing and see our teaching videos. And then after they watch them, they say, okay, you know, that was helpful to me and I'm ready to do my procedure. Because patients come in now and they already know us. They know who we are. They know what we're about. They've already seen us do the treatment. There's really no better consultation than when patients have seen what we've done on our video. How long have you lived in Florida for, Ellen? I'm going to turn your head this way a little bit.
Well, believe it or not, I first moved here in 1969.
Oh, wow.
But
Okay.
have moved away and come back a few times.
Uh-huh.
But I've been here many, many years.
You feel a little pressure pinch here?
A little bit, but not much.
Yeah, so if she's feeling little, not much, and then by the time I'm done numbing, she's just not going to feel a thing. Little pressure pinch, pressure pinch. Everything's looking good. And for the physicians and students that are watching, it is so important to always communicate with your patient and let them know, because they're wondering in their mind, they're saying, is everything all right? And so you got to tell them everything looks really good. And for the physicians and students that are watching, make sure you go to our website, practiceprofitabilitymd.com, where we teach doctors the best practices on how to take care of your patients. We are going to be at the Tampa Convention Center, October 18, 19, 20. Hello, Mildred. Thank you for watching and thank you for sharing. Definitely let your friends know you're watching live surgery, because they're going to get upset with you if you didn't tell them. You tell them that you're watching live surgery and then you didn't share it with them. They're going to say, well, how come you didn't let me know? So make sure you tell them and help us dispel the myths, and also help us to educate people on what their options are. People are unaware that they can do this, and we do a lot of fillers as well. We have permanent fillers, we have short-term fillers. I'll do about 200 syringes of filler every month. And as the physician, patients want, they certainly look for that expertise. Now, let me turn your head this way. Now, because my schedule's so full, we have a nurse injector who can get you in on the schedule much more quickly, and she's amazing as well, trained by me and making patients really happy. So Caitlin, our nurse injector, make sure you ask for her by name. She's definitely able to get patients in same day, and my schedule just was not able to tolerate that before because we're so busy here. So doing the tumescent solution, it has lactated ringers, bicarbonate, and lidocaine, and a little bit of the epinephrine. You feel a little pinching there, Ellen? Not too bad?
Much.
Okay, it's looking good. And I have such a great team. I feel so much love in the office every day. They take wonderful care of me. I feel very well taken care of, and they take great care of our patients as well. Everything's looking good. All right, very good. Thank you for watching, Ada and Mildred. Very good. Ellen, no sentir mucho duele. Nunca duele. Are you feeling any pain right now, Ellen?
No.
Nunca duele para Ellen. For our patients that speak Spanish, we have a lot of patients that speak Spanish on Facebook. So Sylvia says she needs that. All right, give us a call, 813-463-9245. And happy to share with you what your options are. So once I do the tumescent solution, I'll do a little bit more down here. And then I'm going to use the 27 gauge. So I didn't use all the tumescent solution. This is 27 gauge, 1% lidocaine with 1 to 100,000 epinephrine. Thank you for sharing, and make sure your alerts are on, whether you're on YouTube, Facebook, Instagram. We're all across social media. We generate millions of views on our social media. It's a really important way to educate patients and physicians. Let me turn your head all the way over this way. And as you'll notice, when I turn her head, I'm grabbing her from here and letting her turn her head, but I'm just giving her a little bit of guidance. That's all I need to do. And then she can make the turn. That way it feels most comfortable with her neck, because you don't want to, be strong with the patient's neck. Let them guide the maneuver. It's always safer that way for the physicians and students that are watching. Okay, so now I'm doing the 1% lidocaine right across where we make the incision line, so you feel a little bit of pinching there, Ellen. Very good. So you can find us at imagelift.com. If you're interested in the pricing, you can go to imagelift.com/pricing. You can also go to imagelift.com/events. Let me turn your head this way to find out when our next event is. We have a seminar coming up this Thursday. And I'm not exactly, do you know where that seminar is?
Sun City.
Sun City seminar on Thursday. We do seminars almost every week, and we have so much fun at our seminars. Models are there, there's food. And if you can't make it to a seminar, that's fine. You can come to our office, and we'll give you all the information that you need. But come to a seminar, bring a friend, or come to the office and bring a friend. This way you can learn what's right for you. Thank you for watching. Thank you for sharing. Everything's looking very good. You used to have to go to the university to see these things and look over the professor's shoulder, but now with our broadcasting studio that we carry around in our pocket, we have a global audience. Let me turn your head all the way this way. And I have doctors and patients all across the world reaching out to us. Close your eyes for me gently. Now I'm just going to draw on the eyelid crease. So in addition to taking the excess skin, Alan wanted us to focus on just a little tiny bit of a fatty pocket. There's really not that much, but I'll take as much as I can. Every patient is a little bit different. This is highly artistic, and it really is one of the highest forms of artistry, I believe, that we can work on living human beings and helping them to look natural. And it's often done incorrectly. So it's really very important that you can find an artist who can be conservative and still get the results that you're looking for. Once I mark out, yes, we're doing neck lifts. Hi, Sharon, thanks for watching. Once I mark out the eyelid crease, then I pinch the skin, and you can tell, I see her eyelid is still closing, so I can tell the amount of skin that I can remove comfortably without making it difficult for her to close her eye. That's called lagophthalmos. If the eye does not close completely, we don't want that to happen. It's normal as we get older, and we won't let that happen because I'm measuring here. If I take that skin, I know her eyelid is going to close. It's normal as we get older that the eye gets a little drier, completely normal, but you don't want to accelerate by creating an opening where the eye doesn't close correctly. Okay, so now what we're going to do is we're going to put little eye shields on top. So your job, Ellen, is keep your eyes closed, number 1. Number 2, we use the eye shields. Number 3, when I use the laser, I'm only going to, do you feel any pinching here? Any pinching at all? Okay, good. If you feel any pinching, you let me know. And then I only activate that laser when it's in a safe place to do so. So the submental incision, and I use the bipolar cautery. Thank you for watching. Thank you for sharing. So this is the bipolar here. I'm going to turn your chin all the way up. Thank you, Ellen. Is that comfortable for you? Okay, good. We're using the Cynosure triplex laser. It's a 1320 1064 wavelength laser lipolysis. It removes some of the fatty tissue. It also creates a thermal injury under the skin that helps to create some tightening with the myofibroblasts. Thank you. I'll get it. Okay, so this is the laser lipolysis here. You see that helium neon beam. Okay, so now I insert through here. and you hear a little popping noise, and that's just the fiber, that's the laser. Every time the laser activates, everything's looking good. Perfect. So with the laser, it breaks up the fatty tissue. We'll also do some direct removal of the fatty tissue. And then the temperature of the skin and the tissues, it gets warmer the more laser that you do. So what I do is I monitor, I can feel the warmth with my fingers, number one. I also watch the level of energy that we deliver. I'll do about 10,000 joules, anywhere from 5 to 10,000 joules of energy. And then Nina has her little spotlight external temperature monitor, so you see the laser guidance beam, and she can monitor the temperature. We definitely want to keep it less than 40 degrees centigrade, which is the temperature at which proteins denature. So if you can keep the temperature in the 37, 38 range, you're okay. You want a little bit of breakdown of the tissues, but not too much, because you don't want to break down the skin. So everything's looking good. Ellen, how are you feeling?
Perfect.
Thank you. I'm glad to hear that. Thank you, everyone, for watching. Thank you for sharing. If you're just now joining, I am Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon. And we are doing an image lift facelift under local anesthesia. This is not a traditional facelift. Patients don't want traditional facelifts. And it takes about 2 hours to do the lift. We're also going to be doing some upper eyelid treatment. I had one of the facial plastic surgeons, Dr. Gentile, he saw me at a meeting and he says, hey Rich, you know, when you're doing the laser right in this area, he says, be careful right there, because that's an area where you can create injury to the skin. And I said, thank you so much for sharing that with me. I said, I absolutely understand and I'm aware of that. But I love that doctors come up to me and say, hey, I've been watching your videos and I'm really, here's some tips and techniques that I have found. It stimulates discussion and it brings us all closer together. So this is a wonderful technology to teach patients, to teach doctors. Someone said, como partido. I don't know what that means in Spanish. But, so we love the ability to share what we're doing and take great care of our patients and educate people, because a lot of people are unaware that you can do this. The moment I tell people, a lot of people who say, well, I don't need general anesthesia, I don't need a full facelift, and the answer is no. Usually you don't, and most patients don't want that. So this is the best result you can get without doing a traditional facelift. It definitely looks natural, and that's what we are doing our best to achieve, to get natural results, help people look good, feel good, do good. That is what it's about at Image Lift. Everything's looking good. Are you feeling any discomfort at all, Ellen?
Not at all.
Me neither. And I know of our patients, if they keep their sense of humor, then I know they're doing fine. So Ellen's feeling very relaxed, and I feel pretty relaxed too, but I did not have any relaxing medicine. We just keep it calm around here because, you know, I'm already retired. I get to do the things I love to do, spend time with people that we enjoy. We have a great
It
team.
means she shared it.
Oh, thank you for compartido. Thank you for sharing it. Much appreciated. Please keep sharing, because people want to know. They're going to be grateful. They're going to say, thank you for sharing that. Like, wow, I didn't know. I had no idea. How's the temperature? And you can see the laser energy delivering through the side there. Okay, thank you. So always fast, but never hurry. So I learned a new word, como partido. Muchas gracias para como partido. I lived 3.5 weeks in Ecuador, and that's where I learned some medical Spanish. I can speak like a second or third grader. I'm better at speaking it than I am understanding it, because if I miss one word, then I lose the whole meaning. But we have a lot of patients we speak to in Spanish. Yo soy el Dr. Castellano, en cirugía de plástica cara, y llamar a la clínica para de consultación, y Facebook, YouTube, Instagram, yo puedo tener de información para tu consultación. So I speak some Spanish, and you know, in Florida, we have a large Hispanic population, but we have patients that come from all across the United States, Texas, California, New York, Boston, Chicago, snowbirds come down, Ohio, of course, Georgia, Mississippi. I mean, really, every state in the United States we've had patients from. So, thank you for watching and thank you for sharing. Please keep sharing so patients can understand. You know, every day we hear people ask us, what happened that people went too far?
Doctors speak Spanish.
Yes, we definitely speak Spanish. Can you check the temperature here? How did they go too far? They needed a doctor like me. They needed someone to keep them safe, to set the boundaries and say, look, you can do this, but here you can't, or you shouldn't do that. So it's all about the artist. It's all about the doctor who is taking care of you and making sure the patient has the right expectations. So how do we do that? Let's do a little mini consultation right now. What are our goals? Number one, if we sag, then we tighten, right? Simple philosophy. Second thing we can do, if we lose volume, we fill. We know we lose volume as we get older, so let's just correct and put back what was already there. Third thing, if we get sun damage, wrinkles, and sunspots, we can polish and repair the skin. The fourth thing that we do is better than everything else, and that's our behavior. Nothing looks as good as Mother Nature's free facelift. And that's our model. When we smile, the cheeks plump up, and it makes us look happier, more full, more youthful. There are 4 rules for good plastic surgery. Safety first. You must look natural. You must prevent future aging changes. And let's get as much improvement as possible. We can't make it perfect. If we need to come back another day and do more, that's better than going too far. Everything's looking good. Thank you for watching. Thank you for sharing. We are located in Tampa and the Villages, Florida. And we have patients who fly out from all across the country, even internationally. And for the physicians and students that are watching, make sure you go to our website, practiceprofitabilitymd.com, to learn how we take great care of our patients. Pricing is at imagelift.com/pricing. So go to imagelift.com/pricing. Yo hablo español también. Muchos pacientes hablas español con mucho buenos tratamientos. En mi consultación, my staff hablas español también. Llama a la clínica 813-463-9245. That's 813-463-9245. Yo puedo apretón de cara, de piel, o dar inyecciones para más volumen, o tratar de piel con laser, skincare, prevenir, y de mucho mejor resultados es sonrisa grande, es mucho mejor de resultados tu cara. Okay, yes, we're in the Villages in Tampa, and pricing is at, pricing is at imagelift.com/pricing. Everything's looking good. Your Highness. Perfect. Great. Okay, so a little bit more with the laser, then we're done. And I feel the temperature with my fingers. I'm monitoring the number of joules we're delivering. Perfect. Everything's looking good. How are you feeling, Ellen?
It's amazingly comfortable.
Yes, very good. Hola, Iris. Muchas gracias para mirar de video. Muchas gracias. Gracias para, what is it? Como, what was that word? Como
partido.
Como partido. Muchas gracias para como partido de video. Okay. 1, 2, 7, 1, 0, 2, 7, 4. Okay, so we're done with the laser. Now I use the Cons facelift scissors. Okay, and I'm gonna have you turn your chin all the way up. Everything's looking good. Thank you for watching. Thank you for sharing. If you're just now joining, I am Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon here in Tampa and the Villages, Florida. Look us up at imagelift.com and practiceprofitabilitymd.com if you're a physician or student and you want to learn how to build your practice. We train doctors all across the country. Can we turn the AC a little higher, please? Thank you. We have doctors coming from Alaska, California, Chicago, New York, Texas, all across the country, learning how we do our teaching on social media, getting millions of viewers. We did a training for the plastic surgeons in New Orleans, and they gave us wonderful reviews. We're very proud of doing CME trainings like that, and our next CME training is here in Tampa at the Tampa Convention Center, October 18, 19, and 20. Okay, so a technical pearl here. This is the traction and counter traction. So between these two things, when I'm holding the skin here, that allows me to stay in the correct plane. I'm in the subcutaneous plane, but you want to leave a certain amount of subcutaneous fat. You don't want a skin flap that is too thin, because then it's a little harder for the healing process, and it just looks better when you have a little bit of fatty tissue on the flap. So that comes with experience. I use both hands. Right now I'm using my right hand, but I was using my left hand when I elevated the flap on her right side. And it's just easier to be ambidextrous. You've done enough of these. It's like playing the piano. You use both hands, and it just gives you a better advantage from different angles. Okay, can you hold some exposure there? Yes, the Clínica Al Dentro, Tampa y the Villages. Perfect. So now I'm just removing some of the fatty tissue that's here. Very good. So a little bit of the fatty tissue that you can see. Thank you for watching. Thank you for sharing. Como partido. Muchas gracias para como partido. That's a good word I need to remember. So you'll see the little bit of fatty tissue, and I'll use my bipolar cautery. You feel a little bit of a pinch there, Ellen?
Yeah.
Okay, if you feel any pinching, you let me know. Si es con laser apretón de piel y quitarse de graso. So we're removing some of the fatty tissue. We figured Ellen doesn't want that anymore, so we'll get rid of it. And what I do is I just grab the fatty tissue and then I'm trimming underneath, and I can see the platysma muscle underneath. I know when I'm down at that level, so I just stay right on top of the platysma muscle. If you go deep to the platysma, there's other viable structures there, so you're always safer from this approach if you stay superficial to the platysma muscle. Head and Neck Anatomy 101. Surgeons are your best anatomists, because we're in the anatomy every day. And it's like, if you're the taxi cab driver, you know your way around the streets, you know how to get from A to B. And as a surgeon, you're constantly moving back and forth between the anatomy. So that's what gives us an advantage doing the fillers with the techniques that we use. So whether you need filler or a procedure or whatever you need, give us a call, imagelift.com, 813-463-9245. We have an office in Villages and in Tampa. Very good. Thank you for watching. Thank you for sharing. A little more of the fatty tissue here. We will be doing the lift from the sides of the ears. That's coming up, and we will be rebroadcasting. So make sure that you are following. Turn your alerts on. Perfect. Okay, so I can directly visualize the little fatty tissue. Also, we have our USF medical alumni group at the Morsani College. And that's coming up the week before my event. So if you're a USF alumni, would love to see you there. I've been getting some response back from the USF alumni who are interested in attending, and it's always fun to connect with other doctors from our medical school class. Hard to believe We have our 20-year reunion from medical school. Time flies. I'm so proud of our doctors and our alumni. Okay, exposure right here for me, please. I'm going to trim just a little bit more fat here because I like to fuss about these little details. And just trim just a little bit more. Perfect. Okay, so now what we're going to do is I use a 2O Merceline. This is an Ethibond suture to bring the edges of the platysma muscle together. Thank you for watching. Thank you for sharing. If you're just joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon here in Tampa and in the Villages, Florida. We're doing an image lift facelift for Ellen. She did not want a traditional facelift. She wanted to look natural, and she's gonna, wants to make her name in the workforce. And when we look good, makes us feel good, makes us want to do good. And patients are living so much longer nowadays. It really is an honor to be a part of people's lives as they invest in themselves. And, the older we get, we still have a lot of life left in us. So let's make the most of it. And that's why we're here. Ellen, how are you feeling, dear?
Fine.
You feel that relaxing medicine settling in?
Mm-hmm.
Okay, good. I feel pretty relaxed too. Everything's looking good. What I love about the videos and education that we put out is patients start telling me about things. They say, oh yeah, I know how you do this technique. I know you have your shiver, your twist technique. I've seen you doing that. I know what you're talking about. And that's very gratifying that they are very well educated. They know what we're about, and there's no surprises because we're as transparent as you possibly can be. This is a live video. There's no editing. You're just seeing it. This is what we do on our daily basis. And I am so grateful for our team. Nina's been with us for a while now, and she's going to go back to school and do her training. And then we have Charlene and Ari and Lainey here. They all do a great job for us and take wonderful care of our patients. Thank you for watching. Thank you for sharing. I'm doing the platysmoplasty now. This is a corset platysmoplasty. And as I talk to doctors, and doctors are a little scared sometimes about putting their videos out there, and they don't know what to say. And I say, just tell people what you're doing. Because when you're doing a video, patient doesn't always know what's going through your mind. The doctor just needs to say, here's what's going through my mind. Here's why I'm doing this. And I'm going to turn your chin all the way up. Is that okay for you like that, Ellen?
Yeah.
If you just say those things, it's so intuitive. It's so helpful for patients to see that. They want to see your personality. They want to understand your philosophy. Because remember, patients are not buying plastic surgery. They're buying you. When they understand you as the doctor and they know you, that's what they're here for. They want your reputation. They want your philosophy. Is that fair to say, Ellen?
That's very true.
Yeah, and so once they know me and they know what I'm about, they say, listen, I trust you, tell me your recommendation. And that's where we really have the best patient relationships. Not a matter of someone saying, well, I want a facelift. What makes you different from everyone else? If you watch our videos, you'll see what makes us different from everyone else. You know that straight ahead. And patients want someone who focuses only on facelifts and the things that they do. So,
And have self-esteem.
Self-esteem, that's right. Right. Because as we get older, things change, Our appearance changes, and people want to feel useful. We don't want to feel like we're not useful in society anymore, people want to feel visible. We feel ignored sometimes, invisible. And so this helps people with their self-esteem get out there, let others know, hey, you're still a vital member of society. Thank you for watching. Thank you for sharing. If you're just joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon here in Tampa and in the Villages, Florida. Very good. You can look up our books on Amazon.com. We guarantee we can make you look younger in the Smile Prescription. We also have our book on Audible.com. You can see our book there. Our books hit the Wall Street Journal bestseller list. We're very proud of that. And we've got more content, more things we're doing soon. So stay tuned. You have come to the right place. We have a plan for you, and we're honored that we can be a part of people's lives when they're investing in themselves. And, you know, sometimes we just give up on ourselves. Don't give up. You've got a lot left no matter what your age is. Okay, so we still have plenty of suture left. I'm done with the platysmoplasty. Now I'm going to look around and make sure that there's no tethered areas. I'm going to put a little gauze in, and as you can see, there's really almost no bleeding at all. Thank you for watching, and thank you for sharing. And I use my scissors to move the gauze around there, so it's almost no bleeding. It's when you're in the right plane, it's just so much easier to do the procedure. It makes all the difference in the world. Okay, perfect. So getting a little bit of the fatty tissue out. Perfect. Over here, please. So now that I've done the tightening, the tissues look a little bit different and they give me more exposure. So when I've got more exposure, now I can much more easily remove some of the excess fatty tissue that causes people call it the turkey gobbler or whatever you call it in your neck. That's where we are now to reduce that fullness and that sagging, and that hanging down of the tissues. Okay, perfect. Very good. Everything's looking good. Okay, on this side for me, please. Thank you for watching. Thank you for sharing. We are in the Villages and in Tampa. We're doing a facelift under local anesthesia. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Ellen, how are you feeling, dear? You doing okay?
Uh-huh.
Everything's looking good. Ellen's speech will feel a little goofy. Release for me, please. Because her lips are numb.
Yeah.
So I'm just going to release a little bit over here.
It's actually comfortable, strangely.
Yeah, well, that's our goal, is to make you comfortable. Okay, so now what I'm going to do is I'm going to, right there, I'm going to do a little bit of cautery. Very good. Release, please. Now I'm going to have you turn your head all the way this way. Thank you very much. So now we're going to do the same thing and tighten in front and behind the ears. So now I use my 15, and that helps us make the incision on the skin. And Ellen, if you feel any discomfort at all, you let me know, okay?
Okay.
So I just remove a tiny bit of the hair here, and of course that all comes back. The hair-sparing incision, we make the incision through here. That way, traditional facelifts, a lot of them used to make that hair go away, and we certainly don't want that. So this is along the edge of the tragus. You want to preserve the tragus. The tragus comes from the Latin word root, like billy goat, like a billy goat's chin. It pokes down into the ear canal. If you feel any pinching here, you let me know, okay?
Okay.
So I'm now the post-auricular limb of the incision. Very good. So now, traction, counter traction, the edge of the 15 blade allows me to open up that subcutaneous tissue plane, and I've got a little vein here where there's just a tiny, tiny bit of bleeding. So now what I'm going to do is I'll just cauterize right across that vein. I can hold some pressure here, grab my gauze, bipolar, and I'm holding pressure right here. And then just a little tiny bit of cautery. You feel a little pinch there?
No.
So I'm just doing a little cautery in the areas where I've lifted here, but you can see there's almost no bleeding at all. And that's a very typical procedure. I do have some patients that are on blood thinners, or may have issues with platelets, and they might have a little more bleeding, but by and large, this is a very mild procedure that is tolerated very well. Release for me, please. So back to the 15. Everything's looking good. I have traction, counter traction with the tip of the 15. And we had a busy day in the office today. We had one patient come through. Her husband was an anesthesiologist, and he knows what it's like to have general anesthesia. And so what does the wife of an anesthesiologist choose? They choose to do a procedure under local anesthesia because it's safer, less risk, less, recovery. Don't get me wrong, anesthesia can be great. I mean, I've had general anesthesia. When you need it, you need it. But if you can avoid it, definitely should avoid it, especially for cosmetic procedures. I'll take the forceps first. Very good. Thank you for watching. Thank you for sharing. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Yo hablar español. ¿Tú quieres consultación? Por favor, llamar a la clínica 813-463-9245. O tú puedo comprar de libro. We guarantee we can make you look younger. Adentro Amazon, audiobook también. Yo hablo español adentro de oficina. Por favor, llamar. The website imagelift.com. So now that I've lifted up the skin, I'll use the Cons Facelift scissors. Okay, thank you for watching. Thank you for sharing. Perfect. Yo levántase de piel, muy suave, ok. Cuando tú estás al dentro de correcto plano, un pequeño sangrado es muy fácil para hacer de cirugía. Ok. Muchas gracias para como partido, and thank you for sharing again. We measure blood pressure, we measure your oxygen, we measure heart rate, but the most important thing we measure, how's the patient doing? So Ellen, I'm just gonna move you just a little bit here. How you feeling, Ellen?
Which one do you want to move me?
You're doing great. You can stay right where you are. I just had a little bitty adjustment. Very good.
I'm pleasantly surprised. If you
Yeah,
can
most people are
understand
surprised about how simple it is to do the procedure. Everyone's different. Some people have a little more recovery, some have a little less, but when we're doing the actual procedure, I mean, once you're numbed up, you can't tell what we're doing. That's the right way to do it. This local anesthesia plus vocal anesthesia. We talk to the patients, let them know what's going on. When they hear me talking, they know everything is fine. They hear it in my voice. This is like meditation for me. I love doing procedures because I know where the anatomy is. It makes me feel good. I've done this thousands of times. Everything's looking good. Thank you for watching. Thank you for sharing. In fact, when I first started doing surgery, when I was in college, I used to play a lot of video games. And everyone talks about video games not being that good, and I get it. You certainly don't want to have that be the only thing you do. But I played so many video games. When I would do surgery, I could do surgery and I could watch the camera at the same time. People would say that, that's just our pedal that got dropped, nothing surgical. They would say that, wow, you're really good at doing these endoscopic procedures where you have to look at the camera and operate and move your hands. So that's a skill, and it's hand-eye coordination. And so, I try to remember that now that my kids are playing a lot of video games. But the video games are so good now, my goodness. Can you, and then what I do once I lift the skin, then I find if there's any little fibrous attachments, and I can lift those areas as well. Okay, very good. Perfect. Exposure, please. And lift up for me. So now what I'm going to do is I'm going to do some tightening. It's called a SMAS plication. And there's also a SMAS imbrication. I've done it both ways, but I found that the plication does great for what we're looking to achieve. So this is the 2O Ethibond Mersaline. and I'm tightening in through here. I'll take a distal, or it's a little more anterior bite of the SMAS, and a little more posterior right in the pretragal region, right in front of the lobule or the earlobe, and then I'll take another pass of the suture more anteriorly, and one more posteriorly in front of the tragus. And so now once I've placed that suture, I'll grab the edge and I'll start cinching it up. I'll bring it together, double pass surgeon's knot, tie it down, then we flash the suture, which means we use a hemostat to clamp the knot, and that way it holds the tension while I throw down another knot, because we want to do this under tension with the sutures that are deep. And when I bring it back and forth, that is cinching the knot down. So now I'm cinch, 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 cinch. Okay, and then I bring it over so that Nina can trim the knot. That's right on the knot. And we don't leave a tail there, because then it's easier. Sometimes the knot can come out like a splinter, or we call it a foreign body. Everything's looking good.
Yay.
Thank you for watching. Thank you for sharing. Muchas gracias para como partido. I hope that's what that word means. We're just taking their word for it. If it doesn't mean that, then we're saying something else. We'll find out. People will tell us. Very good. You feel like getting tighter, Ellen?
Yes.
Okay, that's what we're here for. And your lips will feel goofy and numb because of the numbing medicine. But you can already see how nice her neck and jawline looks. I'm so excited for Ellen. She's going to love it. Of course, we cannot be held responsible for any behavior people get involved in when they look younger. That's up to them. But Ellen always behaves. She is always behaving so well. And if she misbehaves a little bit, that's okay. Because even if she misbehaves, it's still pretty darn good behavior.
I do notice a little liquid, it seems like going into my right ear.
Yeah, you'll feel a little fluid in there,
Yeah.
and then that seeps out. The moment we turn your head
Okay.
to the other side, that'll seep out.
Okay.
And if you look closely, you can see here's the cartilage, here's the skin edge that we're going to recreate the tragus. Really important to recreate the tragus, because if you flatten the tragus, or the word for it is called tragal blunting, then it doesn't look as natural, and it's a little tiny giveaway for facelifts, but that's why you recreate the tragus appropriately. So double pass, surgeon's knot. We flash the suture. I'm cinching it down, 2 fingers, cinch, cinch, cinch. Now I'm leaving that open for, there's the flash where she holds that tension of the knot. Now I'm cinching that down and she slides out, cinch, 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 cinching things down, cinch, and cinch, cinch, cinch. 4 throws, 4 knots is plenty. And this little extra suture, then I just get rid of these, get these off the field. Okay, so now I'm going to use the curved mayos, and that allows me to do a little bit of undermining. There's a little tiny dimple there, no problem. I just undermine, and it makes it smooth so you don't see that dimple so much. And then even if I left those, they would still probably heal pretty well, but we're here, let's make it better. So now that looks nice and smooth. And I'm going to release back here a little bit. Perfect. So, what a nice jawline. And we're going to take all this extra skin. Very good. Release, please. Okay, so now I'm going to use a little bit of bipolar cautery. Everything's looking good. We will be rebroadcasting in a little bit. Go ahead, exposure, please. The edges of the dermis are good places to cauterize for the physicians and students that are watching. Those are common places where you see a tiny bit of bleeding. We call them dermal bleeders because the dermis does have a blood supply within it. That's why it's so important to have a healthy dermis, because you're getting blood and nutrients and washing away of the waste products. Ellen, how are you feeling, dear?
Relax.
Okay, good. I feel pretty relaxed too. And Nina has everything. How's Nina feeling? Is Nina doing all right?
Doing really good.
Nina's doing great. She's our rock. She's our anchor person. And nothing gets done without Nina and Lainey and Charlene and Ari out here. They really make things so good for us.
Mm-hmm.
So 15 years of practice since 2000. Well, it'd be 14 years rather, because I started my practice in 2005. So now that we're in 2019, 14 years of practice and 20 years out of medical school, 6 years of training, 1 year of internship, 4 years of residency, 1 year of fellowship. Flies by. Everything's looking good. I no me atrevo. No me atrevo. Don't know what that means. I need a Google translator. Tu puedo.
Is this a facelift?
We're doing a facelift under local anesthesia.
She's
Thank you, Saralina. She's so brave. Ellen, do you think you're being brave?
I guess so.
She is, but she doesn't feel brave. She just feels relaxed. This is the most relaxed brave you'll ever see.
It
This is,
actually feels good in this
yeah, I feel pretty good too, you know. I mean, and this is as relaxed as you're gonna be being brave. In fact, she can even yawn.
A massage.
Yeah, it's like a massage. She can even yawn while she's being brave, you know. So, very proud of our patients. Everything's looking good. Thank you for watching, Phyllis. Thank you for watching, Saralina. And thank you for sharing. Please do share, because it allows others to understand what is possible. A lot of people are not aware that these things are possible. So thank you all both for sharing. Now I'm going to do some sutures. So we do a deep suture. Everything's looking good. My pleasure. And thank you. So this is a 2-0 vicryl. I'm grabbing the dermis. Okay, come to Florida and visit. We have some of the best beaches in the world. I was out at the beach this weekend, and boy, was it hot. It was a little too hot. Even though I was all sunscreened up, it was a little too warm. And then I had to sleep. I have to do some extra sleep when it's hot like that out there. So we had a good time at the beach out at Clearwater. Got to take advantage of it. Okay, so now just superior to the tragus, I'll put a suspension suture there. Make sure we have good approximation. We like to use all these fancy words. Makes us feel important. Okay, but it just brings the skin edges together. Perfect. And then Nina's going to cut that right on the knot, which means there's no tail. There's no strings hanging from the knot. Same thing over here. After I do these deep stitches, then what I'm going to do is I'll do some numbing for the eyes, because we're going to do the upper eyelids. I'll grab the skin flap here and then just put a little bit of the stitch. Perfect. And one more over here. Sometimes these stitches can resurface like a splinter. If that happens, that's easy to take care of. But most people, the stitches either dissolve or they get covered in scar tissue and then they fall away on their own. Very good. Okay, so that's 4 there. Now I'm going to do some. You're not brave to do it. Okay, someone said they're not brave to do it. Okay. Well, that's the good news, is you don't have to be brave.
I wasn't brave.
You feel a little pinch, 1, 2, 3, pinch, little numbing. Yeah, you don't have to be brave to do it. You just want to look, you have to look younger, want to look younger rather. Everything's looking good. Thank you all for watching. It is really important. Thank you so much for sharing. Allows us to spread the message and educate people because there's a lot of misconceptions. In fact, there's so many misconceptions out there. I don't even watch the internet news anymore because it's just all so negative. I can't do it anymore. So I just catch headlines here and there. But we put out our own information. The solution to pollution is dilution. So we want to, let me turn your head this way. We want to put out good information, real things that are going on, positivity, people making a difference in their lives. That's what we're going to put out there and create a foundation for others to help themselves and make the most of their lives, transforms their lives. This is a transformative process. It is so beautiful to see patients come back. Oh my goodness, we had one patient show us her driver's license. She had to renew her driver's license, and her before and after picture on her driver's license, it was insane. It was so good. And her family and friends couldn't figure out what she had done. Okay, so now I'm doing the 5-0 chromic. It's a very fine stitch. I'll do about 50 little passes here on this side and 50 on the other, and so a combination of those allows me to approximate the edges. The best incisions, the ones that heal the best, are the ones that are under no tension and the skin edges are approximated very closely, very nicely. So I'll do about 4 or 6 or 7 knots here, just a little extra. It's a long stitch, and then Nina trims with, this one's with the tail. I'll get rid of these little suture edges just to clear my field. We call it the field. That's just what it's called. And the soccer field needs to be clear. Football field needs to be clear to have good football game. Same thing with surgical field. You gotta have it clear, good space, ready for whatever you have in mind. No clutter. Hi Nick, thank you for watching and thank you for sharing. Your friends are gonna love this if you share with them and say, wow, I saw live surgery today. This is live. It does not get any more real than this. Perfect. Very good.
Hi from Maryland.
Hi, Maryland. Hello, Francis from Maryland. Hi, Ann. Thank you both. Please do share with your friends and let them know live surgery. You don't need a traditional facelift. We have, also what I'm going to do is I'm going to do a little trimming of the tragus to make sure that it fits the shape that I want it to. So now I'm reshaping, redesigning the tragus so that it looks just like it did, but it's with different tissue. So as long as you have a little tiny excess, and I'll trim a little bit of the fat here, not too much, so that it retains the normal thickness. So that sits nicely and perfect. Okay, so now we're gonna get ready to do the eyes, and we will be rebroadcasting it a little bit, so make sure you are subscribed, that you get the alert, so that way when we rebroadcast, that you will know. You'll get a little message saying, hey, Dr. Rich Image Lift is getting ready to do their thing, and you don't want to be left out. This is the future of medicine. Teaching through live videos, telemedicine. It's a great time to be alive. All through our AT&T and Verizon plan, we have a global audience and a global broadcasting station. Oh, you're my pleasure, Patty. Thanks for watching. Yeah, take the mystery out of it. You don't need, let's see, I'm gonna grab my suture here. Nothing to be mysterious about here. Perfect. We've been growing. We've hired some new staff lately, and for those of you who want to get, my schedule is pretty booked out, but Caitlin, our nurse injector, who's amazing and trained by me, her schedule is more open, and we do have a few specials on her schedule. So Make sure you are calling in to get your appointment scheduled for your Botox and filler and get it done by the experts. Okay, great. So now I pick up that suture. We're doing a facelift under local anesthesia. Thank you for watching. Thank you for sharing. If you're just now watching, we're at imagelift.com. Look us up, or for the physicians and students that are watching, please go to practiceprofitabilitymd.com. We have a convention at the Convention Center in Tampa, CME credit. Patients don't want general anesthesia and they don't want to look unnatural. So our rules are, number one, you must look natural. Number two, we got to keep you safe. Number three, let's prevent future aging changes. And number four, let's get as much improvement as possible. Thank you for watching. Thank you for sharing. Yo soy el Dr. Castellano. Yo hablo un poquito español. Muchos mis pacientes hablan español de oficina. Hablar español para apretón de piel o dar volumen con inyecciones. Por favor, llamar a la clínica si tú necesitas un poquito más de información. Muchas gracias para, what's the word again? Como partido. Muchas gracias para como partido. We're doing a facelift under local anesthesia. Thank you for watching. Thank you for sharing. Make sure you're subscribing because we will be rebroadcasting in just a little bit. Ellen, how are you feeling, dear?
Okay.
Ellen's doing great.
Okay.
She's looking. Ellen, you are going to love your neckline and jawline.
Great.
How much?
The costs are, go to imagelift.com/pricing. imagelift.com/pricing. Very good. Everything's looking good. Thank you for watching. Thank you for sharing. Your friends are going to love you for sharing live surgery. They're going to be upset if you didn't show them while it was live. Most surgeries are videotaped, pre-recorded. But we'll do it live so that you can see total transparency happening as it happens. Very good. We're in Tampa and in the Villages, Florida. Everything's looking good. Download our book from Amazon. We guarantee we can make you look younger, and the Smile Prescription. Both hit the Wall Street Journal bestseller list. ¿Tú quieres consultación? Por favor, llamar a la clínica. Y yo puedo dar consultación acerca de teléfono. Yo hacer 4,000 facelift cirugía y tenía mucha experiencia. So I hope you understand mi mal español is no está bueno, pero I do speak some Spanish. Okay, so now we're done with the lifting part. We did the stitching here. Very good. Thank you for watching. Thank you for sharing. I'm going to move your head just a little bit to here. Now, I want you to do me a favor. I want you to go ahead and open up your eyes for me. It's harder to open the eyes because of the numbing medicine. How many fingers here?
The little that
Blurry. How many fingers here?
I can't. I never heard.
Can you say how many fingers here?
2,
How about over here? How many fingers?
3.
Okay, good. So now that I've done the numbing medicine, I'll do just a little touch more of the numbing. 1% lidocaine with 1 to 100,000 epinephrine. Very good. Thank you for watching. Thank you for sharing. Can you hit the button for me, please? Sure. Okay, so we're just doing skin deep here, but I will take a little bit of the fatty pocket medially because that was a concern for Ellen. She wanted that fullness and that puffiness to be addressed. So we're going to work on that. And we customize treatments for patients because everyone is different. Can we turn the AC a little cooler? And this one down on the bottom, we want to start Instagram one more time. I guess we're going to be on the bottom, yeah. If you just hit the button, you have to push it. You have to push it from the back and it'll move the whole thing, yeah. So now I'm trimming the skin. You can see the orbicularis oculi. That's the muscle that's beneath. Very good.
Oh,
Here you go.
you want to share that first one?
Yeah. Now that I've taken away and then hit the camera up on top and then hit the live, that's on type, hit live. And then zoom in. Make sure you're zooming in. 2 fingers, yep. There you go. Okay, everything's looking good. Thank you for watching. Thank you for sharing. We're doing a facelift under local anesthesia. Thank you, Betty, for watching. Thank you all for sharing. The shares really help us to spread the message and help other people understand what their options are. Very good. Perfect. So now that I've done the cautery here, it takes just a moment. There's almost no real significant bleeding. Now I'm doing a running intradermal stitch. This goes into the dermis from one side to the other. Perfect. Very good. So this allows just a one continuous stitch to close the eyelid incisions. You don't have to do interrupteds, which are more difficult to take out. Perfect. Thank you for watching. Thank you for sharing. We are going to be rebroadcasting here in just a few moments. So make sure you are following or you turn your alerts on, and you can see how nicely that incision edge just pulls together. So what I do when it's time to take the stitches out, we trim one of the knots on one end, and then we draw the knot on the other end, and it just slides all the way through because it's one stitch, one continuous stitch all the way across. And then I just draw that through, so that stitch comes through very easily. And now I get to the edge where there's that little bit there, and now I'm going to draw a little knot. And one more through here. Okay, go ahead. And we always point the scissors. That's too long, that's too long. Shorter, yeah. Just point, make sure the scissors are not pointing towards the eye. And so now we've got 2 little knots there. Hold on, I want to massage that just a little bit. I make sure the length of the knots are, if you bunch the edges up, you want to make sure it's massaged very nicely. Even if it pulls the knot out, you can always restitch it. Go ahead and cut there because there's some swelling. Yeah, that did pull it out just a little bit. So here's what I'm going to do. Now I'm going to create the knot a little bit further out. Okay, so go ahead. Now there's a little bit extra. Okay. Very good, Ellen. You're all done on that side. I'm going to do the other side now. Everything's looking really good. Thank you, Facebook and Instagram and YouTube, for watching. I'm going to give this to you, Nina. And just one more time so that you can see. So you see her neck and jawline. I'm going to have you turn your chin all the way up there and see what a beautiful jawline she's got there. And now what I'm going to show you is here are her pictures from before. And you can see how the difference in her neck and jawline here. So we're very proud of Ellen. She's looking so good. And we've got a nice improvement. There's her jawline before. Here's her jawline afterwards. Congratulations, Ella. We're going to have Ellen. We're going to have more video coming soon. Thank you all for watching.